thank you so much for taking the time to speak with us today. And to begin, could you briefly walk us through your educational and professional journey and what initially inspired your focus on hematology and clinical research?
Well, I'm probably a little bit the exception, and I have to excuse for that because as a youngster, I really wanted to get into cardiology, and I did everything, and obviously I failed. And then just by accident, during my rotation in my clinical training, I went on the oncology ward. I have to explain, in Germany, hematology and oncology is together. And in fact, the attending physician was some kind of role model for me. So I first of all learned that I directly and connected to the patients, and then so I got the feeling this thing, what I'm doing, makes sense. And secondly, I really admired this guy. So I said, if I want to do some medicine, I want to do it like this system, interactive, shared decision, also interprofessional, and that is finally what brought me to hematology.
What can attendees expect from participating in an EHA Congress, and why do you believe it plays such a critical role at the forefront of hematology research and innovation?
Well, I think EHA is now really the marketplace of scientific news. It's a point where you get really the top-notch new developments, but you get also a lot of education, and you have a lot of networking. So as you can see, there are lots of people, having some interaction, discussing new trends and strategies. So this is exactly what EHA is about. This is our mission, to connect people and get them together.
As the Scientific Programme Committee Chair at the EHA 2025, what were the key considerations that kind of guided the development of this year's Congress programme, and how has the committee worked to ensure the content is relevant and engaging for such a diverse audience?
I think it's really an amazing experience, and I really would like to invite everyone to join the program committee, because you really start from the scratch and you really ask yourself, what are the brand new things for this year? And then you have to look in advance, because you have to think about what's hot in 1 year from now. And then we're really dependent on the excellence of our experts. So we have these different kind of islands of knowledge, let's say, the disease-specific working groups, and they work very intensely on the first proposal. And then we have this consensus meeting where we sit all together, try to bring it all together, and for me, it's like a miracle. Because after this very intensive couple of days, you come up with the first draft of the program. It still needs some fine-tuning, some polishing, but it's amazing if you really collaborate with these excellent minds. You come up with this broad, colorful program covering all kinds of different things: clinical training, research, political affairs, and that really is what makes EHA so unique.
So, looking ahead, what emerging research areas or therapeutic strategies in hematology are you most excited about? And how do you see them influencing future EHA congresses?
I think this is really a thrilling time of hematology, because really now is the time where we are moving from old-fashioned chemotherapy, somewhat effective, but also impairing our patients' health, to these new target approaches. Now that has a lot of consequences. That also means that we have to tailor treatment according to the genomic makeup of the malignant cell. But by really applying this in an optimal way, you really come up with what has been called the magic bullet about 100 years ago, really targeting the malignant cell without harming the patient's health. And this is what we are really going for. So what's the holy grail in hematology? This is really long-term remission, well, what I would call functional cure. And we're just at the edge to achieve that with much better tolerated treatments.